A couple's been trying to conceive a child for 4 years. They succeeded and the wife was 16 weeks pregnant when she had a miscarriage. The patient is staying at the hospital for a week now as the doctor is monitoring her per post-miscarriage condition as she's been bleeding, having recurrent fever, and experiencing extreme painful cramps. The husband is worried about her wife's well-being, especially her mental health. Divina, who recently lost her baby, has been sobbing, isolating herself from others, not eating properly,
Please, you have to eat.
and not sleeping well. One sunny morning in the hospital,
Hi, sweetheart. There are no words that can explain the sorrow and pain, the loss of our beloved, but please you have talked to me. I'm just here. Hi guys, good morning. May I speak to with Nurse Karen?
Hi, good morning, Mr. Kenner. How can I help you?
It's regarding my wife.
Okay, sir, please come to this room.
Of course, sir. Thank you.
Okay, how can I help you, Mr. Kenner?
Regarding about my wife, actually I have this her since we lost the baby. She's been crying and wanting to be alone because of that time. And then now I can be talk to her during the night, and then she's staying out having a faraway dog. I don't know what to do anymore. I'm concerned about her.
This must be difficult for you, Mr. Kenner.
Here the nurse slightly touched Mr. Piana's shoulder, which shows that she's acknowledging his feelings. This also indicates that she's actively listening to his concerns.
This must be difficult for you, Mr. Pianar. I understand what you are telling me. I've been keeping a closer look at her during my rounds, and I notice what you are telling me now. As of now, we're still observing her and thinking of the possible options to help her. I am Karen. I am your nurse today. I will take your vital signs if it's okay.
Yes.
Will you state your name and your birthday, please?
My name is Miss Peña and my birthday is August 13.
Okay. Are you okay?
I guess.
You wanna talk about it?
No.
That's alright. I won't force you. I'm always here if you need someone to talk to.
The nurse is showing empathy in this conversation as she is demonstrating patience and is willing to wait when a patient is ready to talk.
But for now, I need you to calm down to get an accurate vitals. I'll be back on 10 minutes if it's okay.
It's okay. Thank you, Nurse Karen.
Okay, thank you. Hi, Divina. I'm back.
Hello, Miss Karen.
I am going to take your vital signs now. Is there anything you need before I start?
No, I'm so sorry, Miss Nurse, for slowing you down. I know you are so very busy today. But thank you, I appreciate it.
No problem. Shall we start?
Sure. What should I do?
Just remove your jacket, please. How do you feel now? I checked your chart and saw that you have not been able to eat regularly. How was your supper? Is there anything particular you would like?
No, I just really don't feel like eating these past few days.
How about the cramps? Do you still in pain?
Yes, a little bit.
In a scale of 1 to 10, how would you rate your pain?
At least 5.
Do you need some pain medication?
No, I don't need. I think I can hold it up.
Okay. What about your bleeding? How many pads you are able to use since the last we checked?
I think it's good. It's around 2 pads only.
That's good to hear. Thank you. I'm going to leave you now. If you need something else, just call me. Here's the call bell.
Oh, thank you, Nurse Karen. Yes, I will.
Okay. Wife doing before miscarriage?
My wife enjoying going outdoors and love talking with friends and family. She was open about her feeling, and that's why I'm really concerned. I know grieving is part of the process, but I am worried. I'm scared that I will lead depression and cellulose drive to it. She has not spoken to me or her friends. She's always crying and does not eat well.
Mr. Edgar, what are you most worried about regarding to your wife?
Well, I'm really concerned about her well-being.
Okay, Mr. Edgar. The hospital offers a lot of support system. I will look into it and let you know as soon as possible. We will keep on an eye to her.
Okay, for sure. Thank you so much, Nurse Karen.
Good evening, Divina. Divina, it's me, Karen. How are you tonight? What's the matter?
My baby.
In this scene, the nurse uses touch and silence to encourage patient to open up.
You know, it's been a long time that we've praying for my baby. How come that God took it away from us? He's gone.
I can't imagine how painful it is to lose my own kid. It must have been really hard for you.
It really hurts. It seems like it's really my fault. It seems like I didn't take care of that baby.
No, no, no. Don't think like that. As the doctor told you, even if the cause of losing the baby is still unexplainable and can't determine. You did the best you could for both of you. You've been diligently attending all your appointments and tests and following all the recommendations and instructions that doctors suggested.
Here, the nurse is providing information and sharing observation that can lead to the patient's better understanding of the situation. Through these techniques, the patient may see her situation to a different light.
Don't blame yourself. What happened is something you could have controlled.
Thank you very much, Nurse Karen. It's really feels good to have someone listening to you, comfort you, ready to help you.
I am here to help, and I and the staff are all here if you need someone to talk to like this. If you can stop yourself from being alone by yourself most of the time, talking your feelings out will help even just a little bit.
Thank you. It's very grateful to meet the nurses like you. It really feels good. So much. Thank you.
You're very welcome. Also, the hospital has a few support and programs to help you deal with your loss. Here are a few of them that I think will greatly help you. Please take your time to look at this when you are ready.
Thank you very much, Nurse Karen. Yes, I will. I will look for it for sure.
If you need anything else, don't hesitate to let me know. I'll try our best to help both you and your husband.
Yes, I will.
Nursing diagnosis, grief and loneliness as related to pregnancy loss, as evidenced by continuous crying, restlessness, low appetite, lack of sleep, and questioning religious beliefs. Plan or goal. I will provide patient with pamphlets for grief support and programs. By the end of the week, patients should enroll in one of the programs. Hopefully, the program will improve patient's mental health. We'll follow up to patient or support group she's going to attend.
The next day, the couple reached out to one of the programs. The patient has been attending a support group for a week now. Marked improvement is observed with clients' behavior.
Hi! How are you both doing? Good! How are you? Everything is good now, thank you. The last time that I came here, it's really extremely hard to lose a baby, but through the groups, you nurses was guiding us, everything went well. Thank you.
Thank you so much for having us.
It's good to hear, Divina. I am happy you're getting better and better.
Thank you.
Oh, so where are you going guys now?